Well, just around the corner, we're talking about public health and the triple threat of COVID, flu, and RSV. Joining us live now is Dr. Connie Park from Kaiser Permanente. Doctor, thanks so much for being here with us today.
Thanks so much for having me. I'm very glad to be here to speak about this important topic.
Wonderful. So let's start with the big picture here. What are you seeing right now in terms of COVID, flu, and RSV cases? Are numbers starting to rise? Are you expecting them to go up?
Yeah, well, right now, with regards to COVID-19 activity, we have been seeing increased wastewater activity. That's what we've been using to get a sense of how much COVID is really circulating. And it's been high in California, and it's been that way since about mid-June. Thankfully, it seems like we are seeing a little bit of a plateau for the last week or so, which indicates maybe the summer wave is starting to level off. And same with hospitalizations. They had been increasing, but maybe we're starting to see a decline this week. Flu and RSV still are still quiet at the moment, but we are starting to see a tick in activities in the Southwest in Florida, which is typically where the season starts. So we are expecting this flu season to get underway anytime now.
Okay, all right. So when it comes to prevention, very important. What should people be doing right now to keep themselves and their families safe?
Yeah, this is a hot topic. There's a lot of discussion happening around vaccines right now. We know there's a lot of confusion about COVID-19 vaccines. And we at Kaiser Permanente have really carefully reviewed all the updated FDA and CDC guidance, as well as the latest scientific evidence and all the recommendations by multiple professional medical societies. You know, we know that there are some groups who probably benefit the most from keeping up with their annual COVID-19 shots. That includes the very older individuals, 65 and older, the very young, those with certain medical conditions that put them at risk for serious complications. But we also know vaccines continue to be safe and effective, and they're one of the most effective ways to prevent severe COVID-19 disease. And at Kaiser Permanente, we believe vaccines are great tools to prevent disease, and we're really committed to making sure our members have access to these critical resources. So we are therefore electing to maintain these vaccines for anyone 6 months and older.
Okay, now is it safe to get the COVID-19 shot, the booster, the flu shot, and the RSV prevention shot all at the same time, or should people be spacing them out?
It's generally safe, and honestly, the best adage is if you're there, just to get the flu shot when you can, to get your shots when you can, because we know that sometimes it's hard to just go back and get them. So it's generally very safe to get them at the same time. We encourage you to get all your vaccines when you have the chance, and continue to stay up to date.
Okay, now for symptoms for COVID, flu, and RSV, these can oftentimes look very similar, but there's some differences, right? So how can someone tell what exactly they have, and when should they actually be seeking a doctor's help?
Yeah, there are a lot of overlapping symptoms between the three. So, the first and foremost is to, if you have access to home testing kits, those have become very ubiquitous and available since the pandemic. And that's one of the easiest ways to certainly diagnose COVID. And now there's more home flu-based testing as well that you can do. So those are probably one of the primary ways that you can help detect which respiratory virus might be plaguing you. And the therapies are different. So it is important to know upfront what you might have so that you can get the treatment that you need.
All right, Dr. Connie Park with Kaiser, thank you so much for your time and insight this afternoon.
Thank you so much.